Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and one of the topics I wanted to discuss with you today is our orthodontic services that we offer in the office. I'm an Invisalign certified elite provider. I've been doing Invisalign for about 14 years now, and I absolutely love the product. People commonly want to know what they can do to treat their children's crowding. Most often, braces now are getting put into children's mouths earlier and earlier, sometimes even as early as age 7. And many parents want to know an alternative for that. So I am now certified in what's called Myobrace Therapy. It comes in children's sizes that are staged throughout different stages of children's transitioning dentition, and they're custom fit to your child's mouth. And what it is an appliance that essentially retrains the tongue to put the forces on the arch in the correct way to accelerate growth and to encourage proper arch development. Now, what most people aren't aware of is that the way the arches form is by what's called a neutral zone between the tongue pressure and the lip pressure. If we didn't have our tongue, our lips would push all of our teeth back because it's such a strong muscle. And if we didn't have our lips, our tongue would actually push our teeth out of our mouth. That's how strong our tongue is. Most children, if they have a lot of allergies, or if they're a thumb sucker, or if they have any other habits, might actually have their tongue be trained to go into the wrong position, which will actually force the teeth into the wrong position and the arches into the wrong position at a young age. Now, the different types of malocclusion that we treat in dentistry are something called Class 2 occlusion, which is a huge excessive overbite or buck teeth, or Class 3 occlusion, which is an underbite or crossbite, where the arch actually develops in a reverse order where the lower arch is outside of the upper arch. Those are the cases when we'd start to intercede at a younger age. With childhood crowding, it's a sign that the upper arch and the lower arch aren't being widened enough. Usually what that tells me is that the tongue isn't being pushed up enough against the roof of the mouth, and the tongue pressure where it should be will actually form a really nice broad U-shaped arch. Most children nowadays are getting a lot more crowding because their tongue isn't pushing up against the roof of their mouth, and a lot of times that's because of an undiagnosed tongue tie, and you can see one of our other videos about that, or allergies. There's a lot of food allergies nowadays that actually most parents aren't even aware of can affect the arch development. So, the proper tongue position is if you were to say the letter N, N, where your tongue hits, just behind your upper front teeth on the soft tissue of your palate, is the correct swallowing position. Now, if you were a thumb sucker, if you can't breathe through your nose very well because you have allergies or asthma, or if you have arch development issues or swallowing issues, what's going to happen is your tongue is going to position in the wrong position. Sometimes it's too forward where it actually pushes against the back of your front teeth. Sometimes it is what's called a reverse swallow, where it's pushing reverse against where it should be. And all of those things will lead to a lot of childhood crowding. So if we have childhood crowding, the baby teeth are much, much smaller than the permanent teeth replacing them are going to be. Typically, they should actually have gaps between them to allow for correct spacing for the permanent teeth to come in without crowding. When I notice this crowding starting early, one of our options for treatment is the Myobrace. And the way it works is it actually deneutralizes the lip forces and the tongue forces, if they're excessive, to retrain them to go into the proper position. So typically, one of the ways we treat these, if they were going with conventional orthodontics, is you would go to speech therapy or myofunctional therapy, which I highly recommend, but it can be quite time involved and most children aren't very compliant. What the purpose of myofunctional therapy is to retrain your tongue to go into that correct N position. What the Myobrace does is it actually has a little tongue tag here, and what you'll do is you put it in your mouth and it'll retrain your tongue naturally to hit this tag, which is the correct N spot, when you swallow. And over time, if your child wears this overnight and several hours in the evening, it will actually retrain their tongue. We also have a series of exercises that they can do in conjunction with this that'll help accelerate the retraining of the tongue. So what you do is you put it in your mouth, just like that. If I could talk with it in, I would leave it in. And what this piece does is it pushes the lip out, so the lip pressure is gone, and then your tongue is naturally going to come to this appliance. And what it'll do over time with wear is it'll start expanding your arch into the correct position. They actually have several adult appliances also that can be used in conjunction with Invisalign therapy, regular braces, or that can be worn on their own for use with snoring, TMJ therapy or TMD therapy, or just for grinding, clenching and grinding of your teeth. So I wear one of these every night. It's called the Myobrace. I hope I've explained the Myobrace well for you. And if you have any questions on any of your exams, even if you just come in to have your teeth cleaned, it's something that I can easily assess to see if you're a candidate for its use.